And there will be one request that please go through the previous recent advances 1 and 2, which were shared. Like I'll share it as PDF also, just as for your revision. Okay, so the few things which were discussed earlier or might have been skipped your mind, just go through them once. Okay. So let's start with today's session. Again, we'll make it as a like both way interactions rather than just one of us like one side goes to sleep. Okay, so there's a image which is placed in front of you, and they're asking you identify the procedure, a principle of narrowband imaging, and mention its one use in ENT, one use in non-ENT, and name the classification which has to be used over here. Okay, now this question can also come to you as a video-based question or a GIF-based question. So you practically you should be ready as a question rather than in front of an image also. They can give you a short clip of 15-20 seconds of endoscopy image, and they might ask you the same questions that look at the video and then answer the following questions. Again, I am repeating to you guys. जो OSCE question है, all the questions will carry amount of marks. Like suppose if this is there, it will carry. This will carry 1, this will carry 1, this will carry 1, this will carry 1. So supposedly you give very much emphasis on principle of NBI. You write about 4 lines and you don't write anything on the name of classification and name of use. So you will not lose on these 2 marks. Okay. So your one target should be that you should attempt all the questions, all the sub parts. That is very important. Not exactly all the questions, but all the sub parts of the question. You have to write something or the other related to your thing. Don't just leave it empty. Empty chodoge to it's gonna be a 0. So that we don't mind. We want at least some marks over there. Okay. So coming to our question per se. So this is basically narrowband imaging. We just know answer. अगर नहीं समझ में आ रहा answer, so you read through the what other questions they have asked to you. You will get a hint of what is being asked. So answer what is the procedure is narrowband imaging. So we know what's the principle of narrowband imaging. Basically, it focuses on some narrow band of light, which is basically your 415 nanometer. Please remember the unit. Okay, unit भूलना नहीं है. Which is basically your blue light. So what does this do? This remains in the superficial mucosal capillaries. Okay. उसके बाद अगला जो डीपर जाता है that is your 540 nanometer, which is your green light. This will go into the deeper layer. Okay. So basically, this is an article, the link of which I have shared to you in the group. Basically, an article of PubMed. उसमें they have discussed the use of NBI in the laryngopharynx and the hypopharynx region. Mainly ENT में it is discussed for laryngopharynx and hypopharynx. But I saw one article जिसमें they have shown that recent advances in NBI. This was the heading of the article. Recent advances oblique trends in NBI. उसमें से they were discussing this growth over the base of tongue oblique the like base of tongue के ऊपर. So these are the images of that. So basically what they do. यहाँ पे second line which you have to remember. एक तो पहला ये हो गया. ठीक है. There will be few people who won't remember much of the thing. So first thing is NBI का you have to see 4 or 5 images so that it gets fixed into your mind that there is something called as narrowband imaging. If you have been using it regularly in your hospital, you won't have any problem. But if you have not been using in your hospital, if you don't, like most of the centers don't have it practically. So we are not very much aware about it. So then you have to remember first this thing that these are the 2 things which you have to write. Second number thing you have to write that basically this is based on pattern of IPCL. What is IPCL? This is
intrapapillary.
Yes.
Capillary.
Very good, Dr. Chaitra. This is intraepithelial papillary loops. So they stain it and the various patterns are analyzed and basically then you come to the result. Now what else they were asking? Something else that name the classification used. So basically there are 2 classifications. One which you should remember is the NI classification. This is not NI. Basically some scientist name is Nee. I'm not sure from which country. So Nee et al. Karke hai. You should remember this name. Uses in ENT. This we all know that in ENT it is used to see lesions of your laryngopharynx and mainly of the hypopharynx region. Early cancers, early malignancies, early lesions. Whereas apart from ENT, they are used in your esophageal lesion. They are used in your colon lesion, polyps of your colon, all those places also. This has been used widely. So moving ahead. So this is the classification which I was talking to you. Laryngeal lesions, they can be given by NI classification, NE classification, whatever you want to answer. This kind of image can also be asked like this. ऊपर देखा था, that was one spectrum of the endoscopy. This is another phase. We are showing some squamous cell carcinoma on NBI, basically all the epiglottis extending to somewhere else. They might ask you what is narrowband imaging, ऐसे करके. Okay. So we have done this thing done. So moving over here. Now again, identify the procedure. Where is it used? So I'll answer for you. This is chromoendoscopy. This is chromoendoscopy. And if they answer specifically, if they ask, तो Lugol's chromoendoscopy. ठीक है? कहाँ पे यूज करते हैं? तो इसके लिए सिर्फ एक आंसर आपको याद रखना, that is esophagus. So to see about the malignancy or cancer or any lesion of the esophagus, then your Barrett esophagus, evaluation of GERD in esophagus, so you can see this type of concentric views are there. So there will be no confusion that this is not trachea. We are not seeing any rings of the trachea. So we know that this is another tubular structure which we have, जो हमारे ENT domain में, that is esophagus. So this has something to do with esophagus. So the name which you should remember is chromoendoscopy. After the completion of the class, take 5 minutes on your Google. Just type the same thing. Chromoendoscopy. How do we do it? How do we stain it? And 4 or 5 images. That's it. इससे ज़्यादा नहीं पढ़ना है. Moving ahead. Now you have. So after the narrowband imaging, after the chromoendoscopy, the third question goes as this thing. So identify what it is.
Smith iodophosphor nasal packing.
Yeah, it is used for nasal packing. Lovely. But this is bismuth. After that, कुछ और है इसके अलावा? Voice was echoing like anything, है ना? Bismuth, iodoform. फिर आगे?
Paraffin paste.
ठीक है? So you should not forget bismuth, iodoform, paraffin paste. So basically, bismuth is your antiseptic. Iodoform releases your free iodine, which again acts as an antiseptic. Paraffin acts as a paste, liquid form रहता है. And where is it used? We all know that nasal packing में use करते हैं. People use it in middle ear surgery also. Gel foam को soak करके डालते हैं. There are certain uses similar kind in the oromaxillofacial region, and this might also be used for nasal packing. Okay, so uses हमने देख लिए. Now there can be one thing which is like what are the side effects of this thing. Okay, so कोई भी side effect anywhere of any drug it's there. Allergy can also be, like allergy should be one of your DD if you don't know the exact answer. So allergy to bismuth, iodoform, this manifests as a common thing. Apart from this, what else can be there? There can be something like as symptoms of iodine and bismuth intoxication. So just remember, just for completion's sake, nothing very important. Just go through them once. Neuropsychiatric में there can be these symptoms, okay, and these are nausea, vomiting, fever. So like you can put it in everywhere, okay. Now, see guys, these things in my last 5 sessions which I have taken, I am like these question has been repeated twice, ठीक है, मतलब 2 साल में 2 बार आया ये question. Keeping in mind the 2 exam sessions which have been taken place. So we all know this is Keter. Now, what are these 2? Can somebody take a try? What is A?
So Larkin's handbook.
B is your handbook. B is your Larkin's handbook. A will be your what is it? This is your perforator.
Perforator.
ठीक है? A will be your perforator. There is a confusion between perforator and PIC. So what they have done is they have shown you the enlarged view. Normally PIC is generally it is bent like this. This is perforator. Then second is your hand burr, and third is your skater. Okay. This is like, see, similar question they have asked twice. This was shared in the group yesterday, and this was the older form which I had. Okay, moving ahead. So second, more on the things. Let's see. We have identified them A, B, and C. What is the surgical procedure where they are used? We know that. And mention the no contact tool for performing this procedure. Please answer. Repeated question.
Laser.
CO2 laser. Okay. What is the wavelength of CO2 laser?
10,600.
आगे क्या है? Unit?
Nanometer.
Nanometer. अरे Dr. Revati, I'm having logging issue. Please upload the link. I missed 13th class. Dr. Revati, are you in? And इसके साथ there is the image of a scientist associated, Chetan Patel. Please see Kumar L. Patel. Okay, so just remember his image. Okay, this image is given in Scotland. He was the guy who invented lasers. Okay, CO2 laser basically. Now coming to this thing, this message I got from many of you that regarding this thyroid scanning. See, there are few things which like to clear about thyroid scanning. Thyroid scintigraphy or the thyroid scanning, this is basically a little bit different from your RAI, which is used for your treatment of the malignancy per se. Okay. So just we'll go through what are the images which will be there, how to identify them, one, and what can be the associated questions that can be asked from the this thyroid scanning part. Okay, so I'll just enlarge it. This is basically your normal thyroid scan. They can even ask you what is the full form of RAO and LAO. Okay, these are the images from various articles. Think of these images, think of these articles. This was basically given in a very haphazard way in our routine books, Scott Brown and जो हम लोग पढ़ते हैं. So like I went through 3-4 articles जहाँ से थोड़ा I have collected it all and tried to make a comprehensive type of thing. It's not a very detailed type of thing, but practicals के लिए you don't need anything detailed, है ना? You need just to clear your exam. So these are the normal images. One. Here they have shown you the images of Graves' disease, MNG, this one, and thyroiditis. So just go through them here, over here, and what you should remember over here, I'll just mention you. Okay, this is how it looks in Graves' disease. This is how the lingual thyroid looks. Now, what all you should remember, I'll take 5 minutes of yours and just update you. So normally what happens basically, radioactive जो iodine है, this is generally injected. In some places they swallow it also, and it is screened by a gamma camera. Now, can somebody take a try? Which isotope of iodine is used?
131.
Okay. So iodine 123, iodine 131, both are used. So what happens? Iodine 131 has a longer half-life than iodine 123. So because of this reason, it has a longer half-life, it will be secreted till a longer time. Iodine 123 is used more frequently. ठीक है, तो पहला क्वेश्चन ये हो गया वाइवा में कि और in OSCE also that which isotope of iodine will you use and why. ठीक है. Apart from this, what else they can use is one or two name you should remember. This is your 99M technetium scan. Okay, technetium per technetate. So what is this? This is again an analog of iodine itself. So this is also used. Now what happens is, apart from that, Allium 201, these are less commonly used. Okay, or 99M technetium system AB scan, which is more commonly used for the parathyroid pathology. ठीक है, so this is there. So now, what you have to tell the patient? There are certain things that you have to tell the patient to hold. What are those things? Basically, hold the, if she is on methimazole or propylthiouracil, so you have to hold it for at least 5 to 7 days before this thing. Okay. Then they'll ask where it is contraindicated. So generally, pregnancy may it is not done. If the lady is breastfeeding, it's not done. Okay. Now, third thing what they will ask you is what you will counsel the patient after this thyroid scanning. So 2-3 things you have to answer. Like one is you have to avoid exposure of urine, stool, saliva, all the secretory fluids for 48 hours at least. Okay. And flushing twice after urination or defecation. Okay. And the guy should avoid going into the public, he should avoid using public transport and all those things. Okay. Now, what are the indications generally? Where do you do these things? 2-3 things you should remember to rule out the DD of hyperthyroidism, basically. Okay. Not hypo. Then second point is evolution of thyroid nodule. Now, one thing that I would like to lay focus over here is that generally in the primary or the major cancer of the thyroid, we gain cold nodule. इसको बोलते हैं cold area. But this is not the only places. Apart from carcinoma, benign lesions such as your thyroiditis, your cyst, adenomas, these things also lead to the formation of cold nodules. Hence, after if the scanning of your thyroid scan, what you do is not explanatory, not effective enough, it should be followed by your routine जो है USG and FNAC करना है. इसके question, your diets, ACR diets का full form you should remember, the classification which we do, and that table you should remember. For FNAC, the whole thing should be remembered for your Bethesda. What is 1 to 5? What are the types? What are the percentage of malignancy? Which you should remember. This you should not forget. Details of these things I have just taken the gist. Those two articles of one of PubMed and one of other one that I have shared on the group. Please go through it. It's a short 5 to 10 minutes read. It will help you out. Okay. Now similarly, there is another brother of the same exam, same procedure, that is system EB scan. This is used for a parathyroid. Similar things, more focusing towards parathyroid thing. So here we focus on the system EB scan. So after these things, let's come to few of other things. Identify the procedure and what is Talbot's law. So can somebody take a try? What procedure are they talking about? Stroboscopy, video stroboscopy. Any answer apart from that? Somebody has different idea? If you have it, please speak it now. It's better to make mistake over here rather than making it on that day of February. ठीक है? So shall we stick to stroboscopy? है ना? Moving ahead. ठीक है? So in stroboscopy, see wherever you see Talbot's law ना, जहाँ पे Talbot's law आ जाता है, अच्छा, my ears are ringing. I thought somebody is wanting to log in. So whenever you see Talbot's law, see there are multiple names over here. That is your stroboscopy, chymography, HSDI, normal जो endoscopy हम लोग करते हैं. Now all things are confusing. So how to segregate them? So one is Talbot's law. जहाँ पे Talbot's law use हो रहा है, that answer will be your stroboscopy because stroboscopy is based upon Talbot's law. Okay, so now we'll discuss something about your stroboscopy. उसके पहले can somebody take a try and answer what is Talbot's law? ये आएगा ऐसे ही आएगा 2 नंबर का आएगा और यहाँ पे when you will be having this thing ना 4 minutes and as you read the question 2 times this time will come to 3 minutes 10 seconds, and then your the panic mode gets on, और वहाँ पे क्या होता है, गलती होती है. So to avoid those mistakes, keep practicing, keep reading. Still 1 month time is there. I'll say what to say. There are people, I'm still getting messages that I got my result and now I'm thinking of preparing for the practicals. Guys, I'll tell you, people, most of you are working on this thing almost 1.5 to 2 months beforehand. You have very, like, I'll say, I'm not saying कि ऐसे ही अच्छा होता है, but you'll always have a upper hand to a person who has start preparing 2 weeks before the exam. ठीक है, पास और हो जाना नहीं होना, that I'll say it's an immaterial thing, because exam they generally don't judge, they'll not be able to judge in 3 hours what you learn in those 3 months, but it should give you confidence. Okay, so keep on practicing. These are the gray areas, these are the mistakes. So can somebody take a try? What is Talbot's law?
Sir, human eye can perceive only 5 images per second.
Okay, and what happens? Yeah, yes, you are right. So this is the first part that Dr. Chatra said. The image on the human retina perceives like this much amount of images over a second. And what happens? After something is perceived on human retina, the image lingers after it. मतलब there is persistence of vision. मतलब image on human retina, whatever is there on the human retina, it lingers on. Remember this word, lingers on. ठीक है? At least after 2 seconds after the exposure. So this is asked. This thing is applied over the stroboscopy part. Now, apart from this, what else? 2-3 points that you should remember. What they might ask you, who found stroboscopy? So one name you should remember. Doctor साहब का नाम था Joseph Plato. There was a doctor साहब. There was a person named Joseph. He used to live on a plateau, and there he found this stroboscopy. है ना, ऐसे करके याद कर सकते हैं. Now, second thing, what happens? They might ask you, what do you evaluate in stroboscopy? And what is the Talbot's law के हिसाब से पूछ सकते हैं, and they might also ask you what is the basic thing they are doing in stroboscopy. So what they use, they basically they use a this word is important. Synchronized. This word is important. I'm repeating it twice. Using synchronized flashing light. ठीक है, अब सिंक्रोनाइज का मतलब क्या है? There are two things which are being synchronized. तो एक चीज जो हो गया light. What is the second thing? It is synchronized to vocal fold vibration. ठीक है. Now what they will do is they will visualize the vocal fold vibration and observe it. ठीक है. And what they will evaluate? You should remember 2-3 names. लिस्ट में बहुत सारी चीजें हैं. If you want to go into details, you are most welcome. ठीक है, but at least 3-4 names you should remember. You should remember what is symmetry between the vocal folds. How is the glottic closure? What is the mucosal wave going like? What is the amplitude of these things? ठीक है. Apart from this, multiple other things are there, but something comes from stroboscopy section, you will definitely be getting all the marks over here. Moving ahead. Now, same thing can also be asked like this. These are the other images which I found in the article of stroboscopy shared in the group. Please kindly go through it, the person who is more interested. As far as I am concerned, if you remember Talbot's law, what you are doing in stroboscopy, images of stroboscopy, indication of stroboscopy, you are good to go. Okay? Moving ahead. Now, another brother of same thing. Identify the procedure. One difference from stroboscopy which they are asking. Now, can somebody take a try? What is this thing?
NBI.
NBI तो नहीं होगा. NBI तो कुछ ऐसा होगा, देखो. ठीक है. NBI is narrow band imaging, है ना? So mostly it will give you these type of monographic pictures. It is not NBI. NBI को तो rule out कर दिया. तो whenever vocal folds जब भी आ रहे हैं, vocal folds में one thing we can be or what we just saw. Yes, ठीक है. Contact endoscopy भी है, but this is actually your HSDI. ठीक है. Another confusion कहाँ पे आएगा? Confusion can come between chymography. What I have actually while going through all these things, I searched a lot about chymography. While जो मेरा residual question था कि there is a short answer question on chymography. But when I just revised it as of now, latest the thing is कि chymography is basically the study of muscles and you plot it on a graph. तो जो physiology में that experiment used to be there. There was a drum which was moving over that. Some paper was there and they used to connect it to some fancy thing, frog का heart और उसके muscle में they used to connect and there was some graph which was coming. So that is basically that chymography, and some people have applied it to over these laryngeal studies, but it doesn't form any sense oblique question over there. So this is your HSDI basically. What is HSDI? This is your high speed digital imaging. High speed digital imaging. Okay. So what happens? We use a rigid endoscope. We use a endoscope to capture images of larynx high rate. कितना high rate? Up to 2000 images per second. ठीक है. So what they are asking is one difference from stroboscopy. ठीक है. So the difference of stroboscopy is that in this HSDI there is frequency independent visualization. So just write it. Difference. ठीक है. There is frequency or rest all is same. Rest all remains the same. This is basically a you're saying
പൂജ പോണം
अच्छा अच्छा
പൊട്ടിക്ക് ഒന്ന് ചോദിച്ചു പൂജയിൽ തന്നെ വിളിച്ചു ഞാൻ വരാം
the rest all remains the same, that it provides the detailed biomechanics, assessment of vocal physiology, okay, due to increased temporal resolution. Over here only I forgot to tell you this one question of full form of SPECT. This is acronym used in thyroid imaging. Please add this full form in your list of acronym. In every year's question there will be one or two acronym. They'll ask you to expand. Okay, so ये पढ़ना है SPECT का full form. अच्छा, so as far as like our exam patterns go, HSDI will what they will do is they will show you either multiple kind of images. कि एक chart में उन्होंने they are capturing 2000 images a second, so they'll show you multiple images, है ना? Or they will show you these kind of like speed images. They'll show multiple arrows, multiple these things. So this is the difference which you will see from the स्ट्रोबोस्कोपी. स्ट्रोबोस्कोपी में ग्राफ वगैरह दिखाएंगे तुमको, है ना? ग्राफ टाइप ऑफ थिंग, दिस टाइप ऑफ थिंग्स एंड डिटेल्ड फाइन थिंग्स अबाउट दी vocal folds will be shown to you if अगर क्वेश्चन पूछ रहे हैं. दिस इज हाउ you can differentiate, है ना? आंसर अगर पूछते हैं कि what is the difference between stroboscopy and HSDI, so this should be your answer, that HSDI uses frequency independent visualization and rest all मोटा same रहता है. I don't find much of the differences. It's just that you invent something new and gain multiple things out of it. Okay, so this is how these things can be asked to you again. इस तरीके से multiple chymograms will be placed. Chymogram is basically study of your muscles. This can be placed and asked you that what is the study which is being shown to you. Okay. Now coming to this thing, identify what is the principle and what are the uses in ENT. So can somebody take a try? ये तो cobbletter हो गया, ठीक है? Principle in ENT and uses in ENT. So I'll say coagulation is again one of the very important topic for your exams. Please go through it. We still you have lots and lots of time. I've shared a PDF on your group for coagulation. It contains about I'll say 40 to 45 pages. उसका पहला पेज देख के डर मत जाना कि 70 pages कौन पढ़ेगा. It contains hardly 40 pages. Most of them are pictorial. And starting का 5-10 pages, last का 5-10 pages are prefaces and वो editorial वाला thing है. Hardly 35 to 40 pages है. ठीक है. Important points I'll cover in the next 5 minutes, but still I'll say coagulation is such a thing जहाँ पे आपको you should know like what all further questions can be asked from that. Please go through that powered instruments वाला जो PDF है 7-8 pages का. I'll share it again on the group. Please go through it. What you should know in coagulation, there are only 2-3 things over here. First is what is the principle of coagulation. यही क्वेश्चन पूछते हैं principle of coagulation. It is an important table viva question also because ये थोड़ा सा नया है, new thing is which has come up. Specific principle है, इसमें you cannot पेलो मचाए something that ऐसा ऐसा होता है. There is only specific two words which you have to answer. अच्छा, first can somebody tell me what is coagulation? मतलब क्या होता है coagulation? If they only ask you doctor what is coagulation, so can somebody tell what is coagulation? Right? नहीं?
Controlled ablation.
Controlled ablation. Thank you, Dr. Amrita. This is controlled ablation. ठीक है, इसी को उन्होंने शॉर्ट फॉर्म में चिपका दिया coagulation. ठीक है. Now, अगर ये पूछते हैं कि what is the principle of coagulation, so what happens is normally जब भी coagulation use करेंगे, so they will use that fluid. Normal saline is used along with it. So what happens is that when current passes through the normal saline, what happens? Saline is broken into both the ions. So these highly energized ions form a plasma field, which dissolves the organic molecular bonds. Okay, so basically it works by using your radio frequency energy and creates the plasma field. So plasma field याद रखना है, which is dissolving your molecular bonds, and there is a saline medium which is present all around it. Okay, so this you should remember. Okay, over here one more question for you. Please, after the completion of class, go and see what is Colorado needle. ठीक है, ये important है Colorado needle. Okay, now coming ahead to the another thing. So coagulation is clear. I think you should be able to answer the things about coagulator. Now just a minute, I'll take and go to the next part. ठीक है, guys, I'll just keep on repeating. There are few things which are very important to you. They can be asked in various sections. So Kaplan-Meier curve is one of them. It is very important. I saw this question while I was first year trainee. I'll not say first year, second year, almost reaching second year. Okay, but I was not in that exam. I was not able to identify even what is this curve. After that, I got this exam in my own session of DNB, and उसके बाद भी एक बार ये आ चुका है. So this is the importance of your Kaplan-Meier curve. Kaplan-Meier curve, basically, I got messages from few of you that उसमें that clarity how to answer that question, it's not coming. Okay, so I'll not go very much into the biostatistic part of it. So basically, it shows you that it's a type of survival curve. It's a type of survival curve. Okay. Now, this image is taken from the article of De Cruz et al. Okay. The same image is given in your Scott Brown itself. The same image has been asked twice because there are few places जहाँ पे India is leading the world in places of ENT. One is your GNA, one is your mucormycosis, one is your C oral cavity. So in initially what used to happen was that see oral cavity, the person used to come with the lesion, people used to excise it with a WLE, wide local excision, and अगर कोई अल्ट्रासाउंड में या ऑन द सॉरी नॉट ऑन अल्ट्रासाउंड, इफ ऑन दैट सीटी स्कैन ऑब्लिक जो MR कराया है उसमें कोई नेक नोट्स नहीं होता था, तो देयर वाज नो नेक डिसेक्शन व्हिच वाज प्रिस्क्राइब्ड. So because of this only you remember कि अपना theory exam में management of N0 neck in C oral cavity is such an important answer, because the Cruz et al. They worked on this experiment. Now, what was this all about? I'll just take 2 minutes and explain it to you how you will interpret this curve and what questions have been asked from this curve. ठीक है? So you can see two things on your this axis. X axis क्या यहाँ पे क्या हो रहा है? There is the time which is going on, and इसमें क्या हो रहा है? Y axis में this is the probability of survival. As you go up, the probability of survival is moving on. So this is the place जहाँ पे people have come into interaction. Now as you will move over here, the time will go, and over here this is the survivability. Now there were two groups, like the patient whom the Dr. De Cruz et al. Was treating. इन्होंने दो ग्रुप बनाया all over multiple places in India, in TMH basically Bombay, और बाहर भी बुला के there were two groups made in which people underwent elective surgery. पहला ग्रुप कौन सा था? Elective surgery वाला ग्रुप था, जिसमें people came with lesion on your tongue. They underwent that excision of that lesion. Apart from that, neck dissection was done for the patient, irrespective कि उनका neck nodes है कि नहीं है. This is elective surgery, so done. ठीक. Then what happened? There was another group जिसमें स्कैन पर there were no neck nodes, कोई neck nodes नहीं है. उनको क्या किया? They were kept under observation. Regular ultrasound उनका होता रहा neck का, and जैसे ही उनका neck में lesion आता, तो they were going into neck dissection. So this was therapeutic neck dissection, therapeutic surgery.